Longevity is basically looking at a cellular level at how you can prevent aging.
Once they do it, their brains start working differently, they're absolutely more focused, the energy level is up to the roof.
The problem is the body's very clever, but where it lacks is the ability to know which cells to turn over and which ones not to sometimes, and that's what happens when we get cancer.
Medicine is not a risk-free activity.
A lot of people will continue to go ahead with the surgery and then the outcomes won't be what people are expected, then they're disappointed and they blame you. Once people start using it, it's quite hard to give up.
Dr. Matteo Vigo is a leading plastic surgeon in Dubai with over 20 years of experience in breast augmentation and cosmetic surgeries.
He is also one of the first UAE licensed surgeons to perform Mia Femtech, a minimally invasive breast enhancement procedure that delivers natural results with minimal scarring in less than 15 minutes.
Dr. Matteo Vigo, where precision, expertise, and care come together to create life-changing transformations with natural, lasting results.
Do you know that now you can reverse or stop your aging process? I'm Dr. Matteo Vigo, plastic surgeon, and I'm here today with Dr. Jenna, which is a specialist in longevity medicine. Welcome, Dr. Jenna.
Thank you. Thanks for having me, Matteo.
So it's a real pleasure for me to have you here, and please introduce yourself to my guests. What is your background? Where are you coming from? How long have you been in Dubai?
So I've been in Dubai for a very long time. Started visiting in about 2010 and have been backwards and forwards ever since. My family are based here, etc. My heart, however, is in a place in the north, a place called the Wirral in England. And I'm very British. If you couldn't tell by the accent,
No.
I'm exceptionally British. I trained in Manchester and I've dabbled with lots of different things within medicine. I've been really lucky to have a super exciting medical career. I've done some emergency, some air ambulance work. I've sang medical songs in nurseries. I've worked in outpatient clinics. I've set up healthcare initiatives, etc. But as I always say, my undercurrent's always been within well-being and wellness. And within the last few years, there's been the emergence of longevity. And it allows me to combine my work in movement, a sort of PT type training. It allows me to combine medicine, so clinical, preventative health, how we can look at cellular health, etc. And also the cosmetics, because I've been doing injectables ever since I left university. So it encompasses the three passions that I have within clinical
So
medicine.
you cover a large spectrum of specialty, let's say, and you look after the person in different angles. That's a good thing.
People have said to me for years, what's your specialty? And I always say people. So I take an individual and I like to wrap my arms around them and find out like, what is it that they need in particular? Is it something to do with their mental health that's causing problems? Is it confidence? Is it some sort of process that's missed or gets through the gaps of traditional medicine? So yes, I use the background that I've had to try and find out what's going on for that person in particular.
Okay, that's very, very interesting. So we know that in the last years, the longevity medicine, the preventative medicine also is booming. What is it all about? We heard this word NAD a lot now. So tell us a little bit about the NAD and the longevity program that you apply in your studio every day.
Well, longevity is basically the looking at a cellular level at how you can prevent aging. We know there are certain products in the body that decline as we age. However, we are in a population now where we want to perform and look how we did when we were at 20 up until sort of the day that we take our last breath. So we've become more demanding, I think, as a population. And our natural physiology doesn't allow that to happen. So it's not the case that we're going to recover in exactly the same way when we're in our 60s as we're going to in our 20s, because that's not how we're made. And what we're trying to do within longevity is to put a framework in place to allow people to try and perform, perhaps not to 100% of what they could, but maybe to about 70, 80%. And a lot of that is looking more at, we call it precision medicine. So I talked about the love of people. Precision medicine is basically making programs and protocols for individuals based on them. So a lot of it is looking at things on a cellular level. Now, you mentioned NAD therapy. The reason I got into NAD therapy was there was this Italian doctor I worked in this sort of surgical hospital a few years ago, and he was really pushing IV vitamins. His name was Dr. Matteo Vigo. I don't know if you know him. And I started doing quite a lot of research into IV vitamins and decided that everyone was pushing it, but it was only really appropriate for certain people. So someone was immunosuppressed or depleted, burnt out, lacking energy, or that they weren't able to get the bioavailability from the vitamins by using it through oral supplementation. And for those people, IV vitamins would be appropriate. For the others, they're just going to get rid of anything that they don't need. And then I heard about this IV NAD therapy that was coming in. And the results of that were just so different. It wasn't like just taking IV vitamins, which is basically providing ingredients for the body to work. It actually seemed to make quite significant change to people's energy levels. So I started looking more into IV NAD. And that's just one of the entry points, I suppose, into longevity.
Yeah, because I've heard a lot of people are using NAD and they say that once they do it, their brains start working differently. They're absolutely more focused. The energy level is up to the roof. And they're really able to perform in all the work, the workout, the family interaction much better. So it seems that it's something really, magical.
What I will say is there's nothing magical at all in healthcare. And I always use the example of, look, if anything I had was magic, the queue for my office would be right the way sort of like back to the UK. And it isn't, sadly, it is not. So nothing is magical, however helpful, absolutely. So NAD, basically, you've got two different forms of NAD. You've got NAD plus and NAD H. And what they do is they bounce an electron between them. And when they do that, they allow certain processes in the body to take place. So one of those processes is to make ATP, which is energy. So it naturally increases our energy production. There are also certain enzymes that are NAD dependent. And some of those enzymes actually make DNA. So they allow for DNA synthesis and cellular repair. So all day, every day, people don't always realise we're making new cells. Right now, you and me, we're all making new cells. And we need our DNA to be able to synthesize, make fresh DNA in order for that to occur. So we're allowing our bodies to replicate and function how they did a few years back, because naturally, as we get older, our NAD depletes. So that's kind of the crux of how it works. Is it magical? Like I say, not necessarily, but once people start using it, it's quite hard to give up.
It's like addictive. Yeah.
Well, yes. Addictive in the sense that it makes you feel good. And traditionally, we always used it IV. There's also NMN, which is a precursor to NAD therapy that you can take orally. The most bioavailable is always going to be the IV, but it takes quite a long time. People have quite a large physiological response. Have you ever taken IV NAD?
Yes, I did.
So it can give people palpitations. It can feel like a sense of impending doom. People can feel really bizarre. And hence why subcutaneous NAD is becoming a lot more popular. I hunted down a company called Vion that I found had this absolutely wonderfully high concentration, high clarity NAD product that meant that you could just inject from home every other day. And I've kind of stuck with them now. And I know that they're bringing in intranasal NAD too, so that people don't have to worry about making an injection. Because let's face it, that's what puts a lot of people off these treatments.
Yeah, definitely. People are scared of needles. We know, we work with needles every day.
Yeah.
People are scared of needles. So whatever is minimal invasive, whatever is less painful, etc., of course, is much more welcome from the people itself. But I have a question, because a lot of rumors are going around the NAD that it can stimulate growth also of cells that we don't want to grow. Yeah. So if you have an underlying cancer cell that is starting, etc. So what are the risks of using NAD? So
it's not just with NAD. We're talking now, within the longevity space is regeneration, and that is allowing the body to regenerate tissues. So I've talked about the importance of cell cycle turnover and how we can support cell cycle turnover. The problem is the body's very clever, but where it lacks is the ability to know which cells to turn over and which ones not to sometimes. And that's what happens when we get cancer, is that suddenly we start to proliferate cells that we don't really want to proliferate. So when you're looking at encouraging cell cycle turnover, it's not going to say, right, well, that's a cancer cell, that one's not. It's going to turn them all over. So it can encourage the growth of a cancer cell. Now, sort of the other sort of flip of the coin is that it also reduces inflammation. So the chances of actually getting a tumour in the first place by using NAD is probably going to be a little bit less. Now, I think patient selection is important. So I would never offer anybody NAD therapy or any regenerative treatments. And that even includes the functioning of somebody's thyroid. If you improve somebody's T3, T4 levels, everything's going to be working that little bit quicker in the body, including growing of a cancer cell, tumour, etc. So I would always take somebody's past medical history. I would always take somebody's family history. The current rules generally for NAD are, I think, 3 years post-cancer that you can start using it. For me, I would keep that 5 years. That's usually clinically when we then sort of sign somebody off for that cancer. If they have a very significant past family history, of cancer, I would tend to encourage them to do some oncology screening beforehand. Once somebody reaches the age of 50, I highly encourage people to do oncology type screening before we commence the use of regular NAD. To just do one IV.
So it's just a precaution. So you don't give NAD like a candy to everybody. You need
Skittles,
exactly. You need to select your patient very carefully and also highlight maybe the reason why they want to do that and understand if this is really because again, as you said, longevity is not NAD only. There are plenty of possibilities. So you need to select the right approach for them.
Well, there are certain companies in Dubai, stem cell suppliers, that will mandate a true check prior to giving stem cells for that individual. And a true check is something that looks for any oncology tumour cells circulating the body to a 94% accuracy at any one time. So even stem cell companies also have a very similar protocol. So it's not just NAD. NAD carries the bad reputation, I guess, but it applies for everything within this space.
Yeah. And talking about longevity, we know also another word that is becoming popular, peptides.
Yeah.
What are them? What differs peptides from NAD? And what kind of peptides are available in the market right now?
So the peptides that are available in the market depend entirely on the market, but I'll share a few that are some of my favourites in a moment. Peptides are just amino acids. So just like if you're going to eat a steak, it's full of amino acids, but lots and lots of amino acids grouped together. Peptides are individual amino acids put in a particular row, up to about 50 amino acids. Over 50, it's a polypeptide. And they are in a very specific order. And when that peptide comes into the body, it tells the body to do certain things. So we have those peptides inside of us already. So that right now, all of us here, the peptides are telling our cells to make certain stuff, do certain stuff. Insulin's a peptide. Mounjaro, Ozempic's a peptide. HCG's a peptide that we use a lot in fertility. But we're now learning about the use of making synthetic peptides to inject that will give the body messages to say, look, why don't you make a little bit more of this or do this a little bit more? Some of the ones that I use most commonly are CJC, ipamorelin, sermorelin. Both of these are growth hormone releasing peptides. Typical client, somebody in their 30s, 40s plus, who feels like they're just not getting the same out of their workouts in the gym, they're not recovering properly. They've kind of heard about using a bit of human growth hormone, but they're scared about the risk of diabetes, etc. And they realise that this is probably a more natural way to do it. Also would help with sleep and REM type sleep, etc. That's a very common type peptide that I would give. The other one is MOTS-c, which a lot of people use to help improve their cholesterol levels, their sugar levels, and helps with endothelial lining of the mitochondria. So again, helps with energy production. There is a whole plethora of them. I'm very well versed in the ones that are in Dubai, but you can read papers about maybe 20, 30 peptides that you've never even seen before, because the list is endless of how many are there. And it's only step by step we're starting to learn about more. The most researched one I'd say in sort of modern day is BPC 157, which increases nitric oxide production, causes vasodilation to the area of whether it be injury or even for the lining of the stomach, to allow for new tissue to be created around that area. So really great for kind of wound healing, etc.
Okay, that's absolutely stunning, and I'm learning every day also these things because I'm focused on something else, but there is a lot of interaction between longevity and plastic. But we'll talk of this a little bit later. Again, as NAD, there is some risk. What are the risks of peptide? We heard some patient who had like an anaphylactic shock during an injection of peptides. What are the precautions you're taking for that, and what are the real risks of these therapies?
So the funny thing is, if you look at papers that surround peptides, there's almost no side effects listed, which I find quite interesting. It almost sounds, I want to say, too good to be true. And then I have people using them. their energy soars, they feel better, they look better, and they feel more confident on the back of it. And sometimes you think, like, what's the catch? Because the body breaks down the peptides into amino acids very quickly. So they don't accumulate. We don't have to worry about how they're discharged within the body. It's all part of a natural process. However, it is still something that's foreign that you're putting into the body. So one, risk of injection, local irritation around the site of injection, always going to be an issue. The fact that it's an injection, there are other ways.
Because also the only way to have is injection, right?
Well, BPC 157 that I mentioned earlier, that can be taken orally, and it has been found that there is some availability of the peptide in the body even after taking it orally, which, to be honest, doesn't really make sense, because really what we should do is our proteases will break it down and then we're just left with amino acids. And that's why we try and bypass the GI tract and inject it. However, at the moment, subcutaneous injection is going to be the most effective way of getting available peptides in the body. There are quite a few people are doing a lot of research into sprays and gels and creams, which I think will come into the market at some point, but at the moment it's not quite there yet. So yeah, you have to inject it, and some people freak out like, oh my gosh, it's an injection. And it also makes it seem more intimidating because it's an injection. But it is very simple, tiny, small insulin syringe. You don't really tend to feel it. Now, I'd say that copper peptide, GHK-Cu, tends to be the one that gives the most local irritation reactions. And some people just can't tolerate it. Like, it just doesn't agree with them, which is a shame because that's the one that produces collagen. And women especially get highly addicted to the effects of the GHK-Cu, especially perimenopause, postmenopause. But the growth hormone releasing peptides are the ones that tend to have had the most anaphylactic type reactions. It's rare, but it can happen. Anything that you put in the body, even if it's a supplement, a food group, doesn't matter what it is, some people will develop autoantibodies against it. So for some people, they will have to avoid that forevermore. Now, the way that I deal with it is I usually will invite people to come into the clinic to do the first administration with us so that we have our crush trolley, EpiPens, etc. there just in case. Touch wood, and it's probably the worst thing to say, but we haven't had any cases yet. I have had people that over time have started to develop allergy type symptoms, and we've just stopped it and said, look, it's a shame. The results were really good. It's not for you, because it's cost benefit.
Yeah,
it's everything
course.
in medicine, isn't it?
Absolutely.
And at all times you have to make that reevaluation. Now, if somebody is seeing me for an online consultation and they're going to have it delivered to their house, all you can do is advise them, tell them the risks, explain, maybe have somebody there that could deal with it at that particular time, get yourself off to the hospital. But I would like to just sort of reiterate that it's very, very uncommon.
Okay. So, NAD, peptides, what else is on the plate for longevity?
There's all sorts. So I did a post yesterday actually giving my pyramid for longevity. I'd say lifestyle, supplements.
The lifestyle is, I always say to my patient, is the most important one.
Absolutely.
People are, and we were discussing before, what did you have for breakfast? I said, I was in a rush this morning, I just had a banana and a coffee. I said, where's your protein? Lifestyle is absolutely important. If you don't follow certain rules, and you don't have to be like rigid and super strict, but you need to have some, pillars in your daily routine that you cannot skip. So lifestyle is number one.
It's so true. And I'm glad you said that about it doesn't always have to be so rigid, because I think some people feel that you have to be very extreme. Obviously, if you want to get the best results, yeah, you're going to have to be extreme. You want to be in a calorie deficit for so long. Probably the best way of doing that is to track your calories. But for most people, I try and encourage sustainable, healthy lifestyles, looking at the 80-20 rule, so that you've got a window or a pocket of fun where you're allowed to enjoy yourself, but generally, you're sensible. So lifestyle, then you've got your supplements, which are your ingredients. We tend to extract the products that we need from food less helpfully as we get older. So we're just giving ourselves more ingredients for everything that needs to take place. And they should be given to you, ideally through a genetic test, so we can actually see what you need. And if you're poor at making vitamin C, you're poor at turning over your cells, we would give vitamin C, nucleotides, etc. Then I look at peptides, which aren't supplements, but they're not medication either. So peptides to help start to optimize. hormonal therapies for appropriate people, because we know that estrogen, testosterone, progesterone decline. For testosterone from the age of 20, estrogen, progesterone after the age of 35. And that has a huge impact in our day-to-day functioning, especially like estrogen. I mean, it affects our cholesterol, it affects, again, our collagen production, it affects our bone density, it affects lots of different processes, and that's going to increase our risk of cardiovascular disease. Then there's this whole category, and this is the bit that people are interested in, and I mark that as the snazzy stuff. So that are things like NAD type therapies, IV therapies. You've got plasmapheresis or total plasma exchange. You've got stem cells, etc., and exosomes, hyperbaric oxygen. And that's kind of where people feel the biohacking space is. But a lot of people will invest their money here without doing all this stuff here. And I keep going back to the fact that there's no point in doing that unless you get the fundamentals right.
Yeah, that's absolutely right. Also in my practice, you cannot come and have a full body rejuvenation or recontouring if there is no substrate of will to change a lifestyle. Because if a patient comes and she's overweight and she doesn't want to go on a diet, eat healthy, being calorie deficit and do the plastic surgery, my role is less there. So absolutely. Going now on the synergy between what you do and what I do. How do you see that longevity medicine and all these fantastic products you just described can help the healing after a surgical procedure?
Well, there's a lot of data to suggest that a lot of the peptides that we use and the injectables like exosomes and stem cells, and just to explain, exosomes are acellular, but they are a medium that stem cells tend to live in, full of growth factors and nutrients that help to support cell cycle turnover, which we talked about earlier. And you've got stem cells, which are usually multipotent type cells that if you inject into whatever part of the body, they will tend to take on the role of that part of the body. So if we were injecting it into wounds, etc., it would help to close the wound and make additional skin, and it would happen quicker. So one of the side effects, dare I say, of surgery, and I'm sure it doesn't happen to you because you have excellent suturing type skills, can be scarring, and it can also be delayed wound closure, which can lead to infection. And also then that can affect the aesthetic appearance of somebody's surgical procedure. So if we can use things like stem cells, exosomes, peptides to help to get a better closure of the wound, reduce the risk of infection, and to speed up the recovery, we're going to try and do it, and it makes a lot of sense. But I actually see not just in the speed of recovery, I also feel like generally there is a synergy with both. For people that are doing facelifts, etc., people that are doing mastectomies or whatever it may be, we also have to think about the overlying skin. There's no point in trying to pull back skin that is not of good quality. And this is where longevity and aesthetics kind of go hand in hand. And it's funny because for a lot of people would say, why I'm so into health, how is it that I do cosmetics? And I say they go together in a way that people haven't appreciated yet. And I think it's only now we're starting to realise that the two do go hand in hand. So, for instance, you talked about how can we improve wound healing, making people eat well beforehand, giving them the supplements, going through my pyramid, giving them the supplements that they need in order to be at their best health beforehand, using the peptides to accelerate wound healing.
The peptide is also used before the surgery or only after?
So I use them all year round. Personally, I think they should be encouraged all year round, because if you have the body working more optimally, you're going to have less damage during the actual time of surgery, and it's also going to modulate the immune response. So there's going to be less risk of autoimmune activation, etc. However, there are certain peptides that are particularly good to help afterwards. So almost from as soon as the surgery is done that you would commence. I have quite a few patients that would take BPC 157, thymosin beta, and both of those are going to help with angiogenesis, create new blood supply to the area, help with the endothelial lining of the wound. Thymosin alpha is going to help with the immunity response so that you don't get infections. GHKCU, copper peptide, is going to help with producing that collagen to help bind the wound together and bind the tissues that are underneath the wound as well. And then you could even look at a growth hormone releasing peptide, because we know growth hormone stimulates new growth. So again, it's just going to take it from having a longer surgical type recovery to try and bring it down as quickly as possible. Because surely you have patients that are non-compliant. I mean, I know I would be a non-compliant patient and they want to just get up and carry on almost like nothing happened the day after.
Yeah, I had recently a patient, I did a scar on the back, I did the buttock lifting, and like 3 days after she was walking on the treadmill, I said, you cannot do it. She had like seroma and a little bit of fluid coming out. And I said, you understand you didn't follow the rules. So giving, of course, the advices, the post-recovery instruction, but also some internal help that they just have to do this will help a lot. So for
those
you,
impatient patients.
absolutely. So for you, that me and Jenna knows since 10 years, maybe we were working before in a previous facility, and then we lost track for a few years because we went in different paths. Now we are working in the same clinic again, and I wanted to have her here because she just joined the clinic a few months ago, and I really want to understand this because I think this is the lacking part in my practice. So I'm giving very good surgical result. I take care of the patient 360 degrees, but I think the combination of these two is the real secret to get the full journey of the patient be spectacular and be really healthy. Not from the surgical point of view, not from the aesthetic only, but from make the patient feel better.
But you have patients that are smoking heavily, and you advise them if you continue to smoke heavily, your wounds are not going to heal in the same way.
I'm not doing the surgery.
You won't do it? Well,
No.
okay, well, perfect. Okay.
No. If it's a specific kind of surgery, if I have to do a breast augmentation, okay, it's easier, or the new Mia procedure, whatever, it's something easy, and I tell them to reduce for the week before, etc. But it's not affecting too much But you have to do a facelift, a tummy tuck, where there is a flap of skin, so the vascularity is fundamental for me. No way I'm gonna do it if they're heavy smokers.
Yeah, but I think that's unique and actually admirable, to be honest, Matteo, because a lot of people will continue to go ahead with the surgery and then the outcomes won't be what people are expected. Then they're disappointed, then they blame you, and it just opens up a whole sort of plethora of problems. So if you can optimize people before they even go into the surgery, and sometimes that can even be as simple as giving, especially for women, an IV infusion that's got a little bit more B12, folate and iron, so that if they have any blood loss during the surgery, they're not going to come out anemic or sort of feeling overly fatigued, and they're a little bit back on track already by the time that they come out of the surgical procedure.
No, but as you said, when the patient comes to you, you do a full history background, medical history of the patient or the family, so you understand who are you dealing with. And again, of course, plastic surgery goes to a very simple procedure like a blepharoplasty, where we could do without any help on these, longevity medicines. But again, a body lift, people maybe who are post-bariatric, lost a lot of kilos, so all the levels of the blood are down. So we need to reestablish an equilibrium, then we can work on. Otherwise, we're going to do damage. Absolutely. And there is, I don't know if you heard the news recently that, the UAE put many strict rules on plastic surgery because there's been a death of a patient for a body contouring procedure. I don't actually know the details yet, but we have a lot of discussion among plastic surgeons because they said plastic surgery is an elective procedure. So it's not something that you need to do because you save your life. And the doctor should be even more attentive on what he's doing because, and it's, I said, I had an interview with a journal and I said, it's not changing anything in my practice, this law, because this is what I'm doing. There is a fine line between negligence. So if you do something on purpose or not on purpose, but it goes beyond the standards and put the patient at risk, or you have a complication that everybody has. I have complication in my practice. You have complication, little things for your things. Medicine is not a risk-free activity. So we need to understand this. So I always tell the patient, select a doctor that is really looking at you as a whole organism, not a breast, a tummy, or a face. There is a whole process that needs to be, and the integration with longevity medicine now can really open the space to even better results, safer, better, long-lasting, because that's also the other thing. Plastic surgery is not, I always tell the patient, the only thing that lasts for the rest of your life is a diamond. I'm not giving you a diamond. I'm giving you a new face, a new breast or whatever, but it's not a diamond. So it's important that people understand this.
Yeah, and like you say, you do something for long enough, eventually something's not going to go exactly how you want it to go. But you also say that plastic surgery is not a life-saving procedure. Of course, it's not going to stop, it's not to try and get someone's heart to keep beating. But I have seen people, because I often work with people before and after surgery, I have seen it change people's lives. Change, not necessarily save, but it's given them the confidence and their mojo in order to continue with their days. And when someone's got confidence and they're feeling good and they're looking better, they tend to do better at work, they thrive better, their social interactions improve. So I disagree with that comment. I think actually plastic surgery can be fundamental for certain people.
No, definitely. And I always say that we are surgeons, but also psychologists,
Yeah,
because
at the
we
same time.
really look into, and a lot of women that come to me, for example, after divorce or after they found out that the husband is cheating on them. So a lot of, emotional things happens, and there's a moment that they want to really take care of themselves. Also, in another podcast, I said about this, the empowerment of women. And again, plastic surgery is also for men, don't get me wrong, but women needs to really feel empowered right now. We have a lot of women that are CEOs of companies. The women are taking a lot of space in the, industry, in any industry, so in the business. So they need to feel confident. And unfortunately, society is still, in my opinion, a little bit tend to, how can I say?
How could you diplomatically
support,
say?
exactly. Support the male roles rather than the female roles.
Yeah.
So a woman to be successful need to be beautiful, need to be charismatic, need to be all makeup, hair done, well-dressed, etc. And so this confidence is really important for them.
Yeah.
And I'm happy to help them, and you do with your aesthetic medicine as well, to boost a little bit the confidence. So I think that also feeling good from the inside with the longevity is another level of boosting.
You can't divide them. My tagline, it's all over my social media, is look well, feel well, be well. And you can't do one without the other, really. If you're feeling better, you tend to look better and you tend to function better. And likewise, if you're functioning better, you tend to look better and you feel better. The three go hand in hand.
Yeah, absolutely. So what are the main, let's say, misconception that people has about longevity? So what are the most common bad comments that they give it to you? Oh, no, I don't believe it. What is the real deal?
I think a lot of people, especially medics, are scared of longevity. And I don't think the use of the word biohacking has been particularly helpful. And there's quite a few really cool American guys, I have to say, that have jumped on the longevity bandwagon, and they're active spokespeople for the industry. And a lot of them aren't medically trained, and some of them are trying stuff, and then a few weeks later it's completely debunked, and they say, actually, maybe we shouldn't have taken that immunosuppressant to try and increase the length of our age, etc. And I don't think they've done the best for us at times. In some ways they have. They've got a whole load of, especially male following, I'd say. So gentlemen in their 40s, their 50s, can really aspire to be like these guys. And then you get other people that are just, they're cautious because, well, hang on, where's the science to it? And where's the medical support and the backing? So what I'd like to say about longevity is it's not just for rich, wealthy people. It doesn't have to just be that snazzy stuff. That's the end game. So it's like if we were talking about aesthetics, people could start with home care products. They could start with maybe some light microneedling, for instance. And then as time goes on, you work your way up to surgery, which would be maybe like the end procedure that you'd look at doing. It's the same with longevity. Perhaps for you, interventions are going to be, let's change your protein intake. Let's get sort of some structured movement in place. Let's think how we can work on your confidence a little bit. Maybe that's all it is to start with. For other people, they'll have maximised all of those at-home type treatments. They're on all these really cool supplements. They know the peptide game and they still want something more. Well, for that person, then we start looking at, okay, have we thought about some hyperbaric oxygen type therapy? This is the time and the resource that it's going to cost you to do. This is how often we think that we should do it. And we get you commenced on that. And maybe that might help some of the PTSD type trauma that you've had in the past, etc. So it's very individual. And I don't want people to be put off thinking it's not for them because they can't afford or they haven't got the time for those really cool sort of higher level interventions.
Yeah, but I think, again, if money-wise can be sometimes a struggle.
Yeah,
Also,
of course.
for my surgery, sometimes people cannot afford, but the time, it's something. I always tell the patient, I don't have time, I need to do the surgery next year. I said, you're here now because you want to change something now, and you find the time. The excuse of not having time, we all make this excuse. I don't have the time to go to the gym, I don't have the time to eat healthy, to cook my meal, I need to do... It's bullshit. We cannot say that,
Well-
but it's not really the case. You can find the time. You need to organize yourself.
Well, I disagree in some ways, Matteo, because I think what you're saying is right. It's dependent on the person and how they want to prioritize their time.
Yeah.
So, for instance, I would love, oh my God, if I gave you the list of the cosmetics procedures I would love, would be here all day. But do I want to allocate my time to recovery? Not really. I don't at the moment. Give it a year, maybe it becomes a bigger priority for me, and that's the time that I'm ready to give my time. For me, movement is a huge part of my life. And this morning, I was telling you earlier, I had to drop my son off for a physiotherapy appointment at 7 a.m. So we had to set off at 6:15. So I got up at 4 a.m. so I could still train, because for me, that's really important. I feel better and I feel like I'm ready to take on the day if I can get that training in. So it's just how we prioritize.
Yeah, absolutely. I totally agree with you. And that's why also you talk about the long-term recovery. All the plastic surgery is going to a fast recovery. We have all the minimal invasive. Just came back from Croatia, where we have this conference about the new breast tissue preservation, which is the new era in breast aesthetics, because people want to do something which is minimal invasive. The recovery is like in a blink of an eye.
Yeah.
And they get the result that they want. And it's really something which is disrupting the whole breast surgery and the whole plastic surgery world. You see nowadays a lot of endoscopic facelifting, so no scars, minimal downtime, people want to go back. Everything is going on this direction. And I think, again, we start working again together since a few months, but we need to really sit down and create protocols for these patients in order to have a synergy between the two words and give the best out of the patient. So you come here, we give you everything that you need, and you will be, back on track in a minute. And that's the real power that we have in our hands, I think, now.
Yeah, I think it's changing, isn't it? I probably still do in some ways associate plastic surgery with having long recoveries. But I know with your Mia treatments now, you said it's minimally invasive, people are in and out straight away. And my job is to help to propagate that and make it faster. The difficult thing is, though, is people will say, how much will my treatments speed up recovery? It's very difficult to quantify a particular length of time, because it depends so much on what they're doing prior to the surgery and after the surgery, like how are they eating, what's their health like generally. And also, we can't run it parallel. So I can't see what your recovery would be like without it, but we can see what it's like with it. But you can't have both. You can only have one or the other. But there was a huge meta-analysis done in 2024 looking at the use of certain peptides and regeneration type therapies to speed up surgical wounds. And interestingly, they didn't use the peptides that we have here in Dubai available. They used things like Tiger 15, which we don't have access to. But there was not one, what's the word I'm looking for? The conclusions were all exceptionally positive when they took huge, big cohorts of people and they sort of combined longevity type regeneration therapies with surgery compared to those that didn't have it at all.
Yeah, no, that's something amazing. And I think we will come up with some new protocols that we want to implement in our practice. So I think we can close up. We spoke a lot of things. Maybe our listener are a little bit confused right now, but if you want to have a consultation for plastic surgery, of course, I'm there for you. If you want to have some more information about longevity and all these fantastic technology that can help you to really feel better, Dr. Jenna is the doctor for you. You can find her on social media. Maybe we'll put here down her social media so you can follow her. And stay tuned, because I think we will come up with something really powerful. And I want to say a little bit disruptive in the normal, traditional plastic surgery and longevity. And a combination of the two can really create an explosive, outcome for our patients.
Agreed. Thank you, Matteo.
Thank you so much, Jenna. It was a real pleasure. If you liked the episode, please subscribe to my channel and put a like. And stay tuned because more and more guests are coming to my podcast. So Beauty Talks by Dr. Matteo Vigo. See you next episode. Because you deserve the best.